So to get started, I just thought we would introduce ourselves. My name is Stephanie Thompson. I am the Health Sciences Coordinator at Tacoma Community College. I work with probably, I've kind of lost count. I think it's 6 different health science programs. And there's an associate's in allied health that I work with. And we also work with baccalaureate degrees at Tacoma Community College. So that's part of what I do in my regular job.
I'm Natalie Wilkerson, and I'm the Career Center Coordinator at Tacoma Community College, and I work with all students coming into the college to do new student orientation as far as their career interest testing, and in that first year class, which we call at TCC HD 101, they do career research. I also help students with employment, resumes, cover letters, internship opportunities, and I'm an adjunct professor for the business program.
Hi, and I'm Marilee Tambera. I'm the program coordinator and project manager at Tacoma Public Schools for a program called Healthcare Careers Academy. It's a part-time 4-year program for students to explore careers in healthcare.
Thank you, ladies. So what I did kind of in preparation, I looked at the listing of all of the presentations that happened this week. So I've highlighted a few here. This is not all inclusive. And hopefully, as you're looking at this list and reflecting on some of the presentations you attended, there's some occupations that might have resonated with you. And as the week has progressed, you've probably been starting to ask the question of, could I really see myself as a blank? If and when the chat gets re-put up, I'd like you to say, hey, here's what really resonated with me this week. I'd love to see what you guys are thinking about. This slide here, even though we have all those presentations that have happened, there's also a whole bunch of occupations that maybe haven't been talked about this week. So here, just to give you an example, I've highlighted some of the options at Tacoma Community College that you might also consider. So for example, we have diagnostic medical sonography, so ultrasound. I think we did have a presentation on that yesterday. Emergency medical technician, paramedic. We have health information technology. So this is more the IT side, people who really like IT that are thinking about working in healthcare. Human services. So if you like working with people, doing case management, social work, that kind of thing. Some addiction counseling that might also fall within that. Nuclear medicine technology. This is for folks that potentially might be working with cancer patients and doing some treatment that way. Nursing, there's been a few nursing presentations, and we'll talk a little bit about that actually today. Radiologic science is another program that I don't think was represented this week. It's really about X-ray tech, could be MRI type work. We have respiratory therapy. And when you think about the current pandemic, what a relevant job that is right now, right? If we didn't have our RTs, that would be really, really hard. And as I mentioned, we have associate degrees in allied health, and also TCC is one of, I think there's 28 community and technical colleges across the state that offer baccalaureate options. So it's really a little overwhelming just trying to think about how to decide how to even get started. And that's what this presentation is really about. It's about helping to wrap your head around it and help you organize your next steps. What do you do next? Okay. And this is where I'm going to hand it over to Natalie. So Natalie, did we decide I'm going to stop sharing my screen here?
Yes.
Okay, bear with us.
Oh.
I'm going to walk you through some of those other.
Problem though, I can't see the PowerPoint now.
Oh, okay. Do you have the PowerPoint up that you could?
I do not.
Oh, okay.
PowerPoint, so
let me.
Sorry about that.
So we're gonna switch gears and go back to this. Does that work?
Yes, that'll work.
Okay.
So sorry about that. So when you're thinking about a career in healthcare, I've heard it. There is almost anything and everything that you can do within healthcare. It's like a large university. It's like its own universe. any job that you can imagine, you can do that in the healthcare environment. So choosing a career in healthcare is like working on a very large research project for yourself as you narrow things down. You need to dive in deep a little bit to look around before you can choose the pathway that really fits yourself. And part of that process for students is asking yourself, what would I like to do? What do I enjoy? What are my skills and abilities? How would I find out about these careers and go deeper on them? So I'm going to share with you 2 different tools. And so I'll have you not share your screen for a second, so then I'll go to mine. So this website that I'm showing you is called Career Coach, and you can access this directly from the Tacoma Community College website. It is a free and accessible piece of technology that we have embedded into our website. In here, if you're wanting to search and know a little bit better about yourself, you can take a career assessment, you can browse careers, you can browse programs, you can look at work opportunities. There's even a resume builder in here that's a real simple resume builder that if you don't have a resume and you just want to get one down on paper, you could build a resume and then download it into Word. But first, I'm just going to show you a little bit about that knowing the self. So here is a very short assessment, and I'm going to act as if I'm someone who wants to go into healthcare. So the first thing is, well, they'll help you find, it's a short assessment with 6 questions here. One of the things when you're doing an assessment is don't worry if you have the education yet, and don't worry if you have the money to make you, how much money you'll do in the job, just kind of be open-minded. So quick questions. Do you like to work with your hands on objects, machines, tools, plants, work outside, use your physical abilities? Agree. Observe, learn, analyze, evaluate, solve problems, question, explore physical, biological, cultural happenings. Strong. So you'd say these: express yourself creatively, use imagination, intuition, inform, enlighten, help, teach, counsel, influence, persuade, so management or organization skills, work with facts, numbers, details, and follow directions. I'm not so sure about that. And then it'll give you your results. And so when I'm working with students and they're trying to explore career pathways, you want them to look at careers that hit their top 3 areas. So the top 3 areas after I've answered this question are investigative. So being curious, looking into things. A lot of people who go into the patient care side of healthcare have investigative as a strong attribute. They want to learn how things work, understand things. Social, so that's working with people, one-on-one, whether in groups, giving presentations, working with a patient one-on-one, working with a group of nurses or doctors. And then realistic. A realistic means that things have order, have a beginning and an end to them. There's a beginning and an end to the day. It has realistic expectations. So then you want to look at what are your 100% matches. So let's just say I'm going into healthcare. So if this is an 89% match for me, but it states 100%, I would start looking at careers under the health science. So medical, administrative, and support services, maybe, or would I want to be in diagnosis and treatment? Let's look at careers in this. Once you start narrowing down your career search, you can start looking through the titles of different careers. So preventive medicine physicians, neurologists, podiatrists, dermatologists, allergists, pediatricians, nurse practitioner. Let's just look at family general practitioner, psychiatrist, surgeons, sports medicine. So everything within that says, okay, your top fits are maybe something within the healthcare. So you can choose one like a nurse practitioner, which is a high level nurse that's almost as much, has the degree that's close to being a doctor. And you can look and learn a little bit about this occupation. Right now, it'll say that the median salary for this is $130,000. And this site pulls from Washington State, in particular from Seattle down to Olympia, and it'll show you job postings for openings. So there's 302 annual job openings right now for this particular degree, and then it shows you programs within it. Moving along, and this is what I really like students to look at when you're doing that, what I say, your research project on yourself, is learning what are the tasks and duties that this particular career does. So if you look at the daily tasks, are those things that you would enjoy doing? Do you want to be someone that has to recommend a diagnosis about or interventions to someone? Do you want to prescribe medications? Are you good with educating people about how to take care of themselves? So writing the pros and cons on daily tasks really helps you kind of narrow things down. Also, you want to see what is the national education attainment level for this type of profession. Well, this is a high level profession, so obviously it's either going to be master's or doctorate level. So just a quick glimpse at what you have to do. What are some of the skills that people have to do if they're going into this profession? Primary care, family medicine, basic life support. And then what we call soft skills are skills that can be self-taught, but are part of what is usually written in the job description as things that you'll need to do. Like, you need to be able to communicate, you need to manage your time well, you need to have compassion because you're working in healthcare, you need to like people, and want to work with people. You can look at the wages for a profession and see what's happening, like trend-wise with wages, and see if that seems realistic. And so on average, about 130,000 for this particular career. And what is the employment outlook for this? So interestingly, we'll see like the trends, like, there were so many jobs around the, right before 2020, then you could see the pandemic hit, and it kind of went flat for a while. So it might move up again. And then one of my favorite places on this particular website is the top companies that are posting jobs. So if you're looking to go into a healthcare career, you also want to look at where are those companies and what are the names of the companies that are hiring this particular nurse practitioner right now. And so I have students look at those top areas and then go to those websites, look at that, what's their mission statement? What does it look like? Be an observer of them from an outside perspective and say, oh, when I'm done with this, would that be someplace that I might be interested in applying? And then this site will go all the way over to live job postings. So probably what most people use this particular website for is just throwing in a career that they're interested in, and then looking. So in a couple slides from now, I'm going to show 5 different areas of healthcare, and you could play around by putting the names of those careers in here and then digging deeper and learning more about them. All right, now I'm going to share this website is called the Washington Occupational Information System, or WOIS.org. So in order to access this site, you do have to have an offsite key, and I'll have them put that in the chat. So www.wois.org, and the offsite key is RPA473, and I can write that again later. But what is great about this particular website is as you start looking at different careers that you want to do, there are even more career assessments in here that you can look at. So if you wanted to do a personality to see if you're a good fit for different things, or if you wanted to say, oh, am I really, is healthcare a good fit for me? Is nursing a great fit for me? It has some information also just in general about the career summary about nurses. But what I even like better than that is all of these careers that are connected to it. So maybe you didn't know, maybe you've always thought you wanted to be a nurse, but maybe you really actually want to be a cardiovascular tech after you read the job description and you look at the tasks and duties. And so you can do a deeper dive on all the careers that are kind of connected to this career. And then this website also has the same type of information as the other, but more in depth, more tasks, more duties, common work activities, what type of classes you'll have to do, what are the working requirements like, a lot of times people you need to decide, like, is it okay, do you want to touch people, not touch people? Would you rather work with computers? Do you want to, some healthcare careers, you have to stand up for a long time in dark rooms. You know, these are things that you need to ask yourself. And so doing your research will help you with that. And as you scroll down, it shows you a snapshot also that what level of degree do I need to have for this career? And an RN is exactly this. It is either contained in as part of the associate's degree, so RN level, or it's a pre-nursing degree that goes RN to bachelor's in nursing. So, and then again, this shows wages down below, and even shows it just for Washington State or different counties. But my favorite other tool that is great on this, I have to move myself here, is that when you're deciding in healthcare, you really need to look at the education aspect of it. And so you need to look at what are the schools that I can go become a registered nurse at. Some nursing programs have competitive entry. So having a list of 3 or 4 schools that you prepare to apply for is an excellent way to go about it. So over here on the side called educational programs, you can just connect to one of these and it will list all of the schools within Washington State that have nursing. So here we have the east side, Kingston-Homish area, scrolling down into Kitsap over past Carver, there's Olympic, Spokane, so Eastern Washington. There's even a distance learning school, which is Western Governors. And then here where we are, Tacoma Community College, a couple of us that are speaking, we're Tacoma Community College, we're on there, and beyond. You can also take this little thing up here, and it's really useful. You can change your state. So maybe you've always dreamed of going to school in a different state. You can find out some more information about that particular state. This is the information that I was showing you about how you can like look at the 5 main areas of healthcare and try to decide within those areas what you might be interested in. So direct patient care, which is the hands-on, you know, working with patients on a daily basis. And this is just a small list of those, but there's a rather extensive list in the website above. But here you find your registered nurse, your respiratory therapist, and then there's a career coach, like the anesthesiologist, dental hygiene, EMT, paramedic. Another big area is just the business itself of healthcare. So a massive portion of healthcare is all of our information. So health information and business. So maybe not working with direct patients, like not having to like touch people or things like that, but you can go into documentation, medical records management, administration, drug utilization, doing the information and communication systems. IT is huge in healthcare because it has to be run. So there's different, even a healthcare administrator, maybe running the hospital, lots of awesome opportunities on the business side of a hospital. Can you please change the slide? Okay, and then Stephanie talked a little bit about this, but there's also imaging and diagnostics also. So using the imaging equipment, some with patients or some not with patients, but you can be involved in the initial diagnosis of what is going on. So anywhere from working in a dental lab to being an MRI technologist, a pathologist, a phlebotomist, you know, drawing blood. So there's a whole large area of healthcare careers. Another one is the research and development. So we couldn't, you know, if we didn't have research, there wouldn't be a way for better treatments for cancer. So maybe you're really into chemistry or wanting to be a biomedical chemist or a biomedical engineer. Looking right now, what about public health? Public health is huge with the COVID crisis and everything that's going on. You could be a nurse who wants to go out and educate the community, things that we might not have thought about. Okay, advance this one. And then another area, facility support. So all of those machines that are in the hospital, There has to be a biomedical equipment technician that works on them. There has to be a maintenance engineers, industrial hygienists. So like, how do we keep the hospitals clean? Or even a librarian that does research. So it's almost endless, the careers you can do. But my advice to you is to use those different websites and look at it as a research project. Make yourself a list of pros and cons. What would I like about this career? What would I not like about this career? What if I dug deeper into this? What could I find out? Next slide, please.
Uh-oh. Hold on. There we go.
Okay. Oh, then it's on to you. Okay.
Marilee, you're up.
Yeah, so this is just another kind of way to narrow down how do I choose a healthcare career that matches what I like to do. And so this is just a handy chart that you guys can look at. These are occupations here that, yes, there's physical contact with the patient, and yes, there's bodily fluid in that contact occasionally. And yes, there's frequent communication with patients. And this next one is, yeah, I like to have physical contact with patients, talk with them, but there's no exposure to bodily fluids. Or there is exposure to bodily fluids, but there's infrequent communication, such as someone who draws your blood, a phlebotomist. And then the next one is, yes, there's lots of physical contact, frequent communication, but no bodily fluids. So that might be someone who does ultrasound or pharmacy or speech therapist. So you can keep looking at these down the line and you can see these later, but this is just kind of another way to funnel down where your interests may lie.
Okay, is this you? Natalie, you're muted.
Thank you. Okay, as you keep exploring, I just want to encourage you to do as much research as possible, utilize the tools that are out there. Career Coach is super easy to get started. It's a simple product to use. You can also go more in depth by looking at the Bureau of Labor and Statistics and the Occupational Outlook, or you can go directly to check out a college. So if I click on this, if the link's working, no, I don't think so. If you check out a college, that will go more in depth on the state of Washington website on different colleges that have the careers that you're interested in. And I'm done.
Okay, thank you. I was going to say too, and unfortunately the link wasn't working, but Career Coach, you can find it through the tacomacc.edu website. So our website, if you typed in Career Coach, you would find it there. And like Natalie said, there's just a ton of information in there that's pretty user friendly, I think, to use. And Check Out a College is also great. The other link was WAOIS, WOIS.org, that had a lot of great data as well. Okay, so definitely just tons and tons to think about. And again, how do you do that deeper dive? There's things to think about. Do you want to do direct patient care? More medical testing, monitoring? Do you want to work behind the scenes with support and operations? What kind of setting do you want to work in? Do you want to work in a small office, or do you want to work in a hospital setting or a long-term care facility? Or maybe it's home health care, going to people's houses and helping them there. Thinking about the cost of the program. How long would it take me to earn that education credential to work in that field? Those are key pieces. Other things I want to share with you, thinking about our healthcare partners, they require everybody to go through a background check. So it's really important to think about, hopefully there's nothing in your background that would be a criminal conviction that can impact your ability to find work in this field. Also, drug screening. All of our partners require our students that come to their site to participate in a drug screen as well as their employees. In addition, immunization. So this is something that you would have to do. And if you don't like immunizations, this may not be the best field for you, right? So thinking about all that stuff. If I've done some of that research, I would start to narrow it down by school options and looking at who carries this program of interest. So things to ask yourself when you start looking at colleges is one question is the program accredited? So what that means is there's been an outside entity that comes in and makes sure that that school or program is teaching at the highest level possible. That's important because a lot of these programs, there's some kind of certification exam that you have to take, and you want to make sure that you're being taught at the highest level so that you can pass that exam and be able to practice, right? So other questions, who would I contact at the school to get started with educational planning? If you're going to the web pages, you'll find out this information. Where do I go to find that? The web pages would have that. What prerequisites do I need to take to get started on this path? There's usually some information on the web pages about job outlook, program expectations, what can I expect when I'm enrolled, and what would they expect of me as a student? Typically, they have cost information, talking about tuition, fees, books, supplies, and more importantly, how can I access resources that will help me mediate these costs? Okay. How are we doing on time? We've
15.
got 15 minutes. Great. Okay. So whatever your goal is, I want you to know that there's usually different paths to get there. So it is important to consider work-life balance. Not everybody out there has the luxury of kicking back and going to school to go get their doctorate. So taking all those years to get their doctorate, they have to work in between. I know, I wish I had a bunch of money to do that. I don't. But really, most of us don't have that kind of money. So the good news is there's lots of ways to work in healthcare and continue to continue with your career progression. So in other words, there might be opportunities to start with a shorter term goal and then go out and work and then come back to school and go back out to work. And it might actually be in your better interest to do that in the long run, because there's very frequently hospitals or larger health systems have tuition reimbursement opportunities available to their employees. The other thing to think about is these are often competitive programs to get into. So it is important to think about having a plan A and a plan B, even a plan C, right? So if you you don't get into your dream is plan A and it doesn't come to pass, I want you to know that there's more than one way to get there, and having that extra plan will help you from getting derailed. Okay. This is a really hard slide to see, so we've kind of broken it down a little bit. This is just an example of nursing. So after high school, if you're thinking about nursing, you would look at that pathway. How can I get started? So the nursing assistant is one way that you can do a short-term training. This can be anywhere from 3 to 4 weeks, or it could be up to 10 weeks, depending on where you go. A lot of community colleges have a program like this, so it's about 10 weeks, or you could go to a long-term care facility and get this training. At the end of that training, there's usually a licensing exam, some kind of certification exam, so you could practice as a nursing assistant, right? Be out there working. Now, the next phase of nursing would be practical nursing. That's a credential that you can earn. And here it shows Bates has a program in practical nursing. That takes about a year. So you could use that CNA or NAC is what they call it, and apply to the Bates program for practical nursing. After a year, if you finish that, guess what? There's a licensing exam to become a licensed practical nurse, but you can take that credential and apply to Tacoma Community College. We're just one example that has an associate degree in nursing. And that's if you want to become an RN. But the nice thing is you've already taken a year out of what would normally be a 2-year program. You've done a year of it already, and you jump in to the second year of this associate degree pathway, right? After you finish an associate degree in nursing, guess what? There's a licensing exam, and then you can practice as a registered nurse. And then after you have that, if you're thinking, I want to go work, I'm happy working, that's fine. But if you want to, hey, I want more money, I'm going to apply to potentially a master's program. And UW-T, this is, again, just one example out there. There's lots and lots of examples out there. You can apply to that. UW-T, UW-Tacoma has a master's program where students that have our associate's degree in nursing can go, and it only takes 1 more year to get a baccalaureate degree. So you're kind of, it's like rungs on a ladder. You start at the lowest rung and then you take the next step and the next step. You're not starting from scratch, right? But it's a way that you can go back and work if you need to, depending on what's going on in your life, right? If you have the money to continue, great. If you have an employer that can help you foot the bill for your education, even better, right? So if you wanted, after you get your baccalaureate, if you wanted to continue, get your master's in nursing, UW has a program there as well. And they have a doctorate prepared program. So you can get your educational doctorate, get your PhD, or become a doctor prepared nurse. And you can work in education, you can work in administration, all of those kinds of things. So lots of opportunities there. I encourage you to continue to look at all the different pathways that exist. How are we doing on time?
9 minutes.
9 minutes. Okay, I'm going to switch over to Marilee. Do you want to talk about another pathway, for example, in pharmacy, how that might work?
Hi, so I'm not going to spend a lot of time on this, but Stephanie gave an example of how one can progress through nursing if you go to those particular schools. This is an example of Washington State University Doctor of Pharmacy School. And this just shows that at a high school, you can go into their Save a Seat program. That's a good word to remember, save a seat, when you're talking to colleges, because it will just help guarantee you a seat. And so in this example, one can go from high school and get into the Save a Seat program if they like, go to Tacoma Community College and do 2 years, have an associate degrees, and go right into the Doctor of Pharmacy school. So a lot of times when you're going on to higher education, they require a bachelor's degree, but this one does not. That's just good information. And I'm not going to spend a lot of time on this, but what we encourage, the three of us encourage you to do is to think about your existing resources. So who are your career counselors at your schools? Do you have a program such as College Success Foundation? Ask around, because I don't know how some of you are feeling, but maybe some of you are feeling a little overwhelmed. Don't feel like you need to do this on your own. There are people out there to help you. There is no right way to figure this out. Maybe one approach might be, I don't want to do any research right now. I just want to talk to people. And so one way to do that is, I kind of think I want to go into nursing. And then you just start asking friends, family, whoever, do you know someone who's a nurse? And talk to them, ask open-ended questions. What do you like about your job? What do you don't like about your job? Where did you go to school? All those questions. And that might really help you get started.
That's great advice. Definitely lots of ways to get started, save money, figuring different ways to get to that end goal. So we're getting ready to wrap it up here, but your head's probably stuffed with lots and lots of ideas. And we talked about the importance of career research. We talked about looking at different options for training, short-term certificates leading to long-term degrees. And I love what you just said, Marilee, because it's about finding ways to make forward progress. And I know we're running short on time. What Marilee said is the best news, really, is that you're not alone with this. And really, I'm just saying that you are not alone in this. What is one thing you can do now, today even, is to make forward progress would be to go to the college fair. And that's a way to establish contact, get on their radar for different events that they might have coming up. They can connect you to different resources, financial aid workshops, etc. So sometimes where you just really are overwhelmed, sometimes it just is good to connect with one person, say, help me, here's what I'm thinking of doing, right? And that's why we're here. It is for real why we are here. It's to help you. So I don't ever want you to feel like you're bothering us or anything like that. It is why we are here, and it's to help you. So after this, we're gonna head to the college fair. I believe what has to happen, there's a link there that we're gonna put into the chat. If you've already registered for the event, you should be able to see it when you log in. There's an events button or tab, and then you would click chat now, and that will enter you into whichever college that you're interested in. So I know we're out of time, but I'm wondering if there's any questions. I haven't been able to check chat while I've been running the screen. Is there any questions that people might have?
I was just going to add also, when you go to the college fair, look at the majors that they have and see if they fit any of these areas that you're interested in, and then ask them specific questions about, how difficult is it to get in? What are some of the prerequisite courses that I need? Would you recommend going to community college first before jumping into a bachelor's program? And they're there to help you. I always like to tell students also, think of the end in mind, meaning you have that particular degree and working backwards. Ask people how they got there. Next time you're at the doctor's office, ask the doctor, how did they get their job? Things like that. That you can start using those types of resources.
I really appreciate all of you attending today. I hope we were helpful a little bit. Wish you the best. Thanks for joining us this week. Make sure you get your feedback form in. Olga, I don't know if you had a chance to put that in there. We appreciate your feedback and you being a part of this experience with us. And we wish you the very best. Good luck to everybody.
Can I open?